Welcome to Fireside Chat with Beth and Matt, where we break down the latest in AI and radiology. Sit back, relax, and let's explore how AI is transforming medical imaging. Imagine getting an X-ray and having the results in minutes, not hours, or a CT scan that can pinpoint the exact location of a tumor with incredible precision. That's the kind of future AI promises in radiology. Today we're diving deep into a research study that analyzed over 500 AI studies in radiology to understand where we are and where we might be headed.
You know what's striking is just how quickly this field is growing. The study Radiology Artificial Intelligence, a systematic review and evaluation of methods, looked at papers published between 2015 and 2019. In 2015, there were only 14 studies. By 2019, a whopping 237. That's an explosion of interest.
Yeah, it really shows how much potential researchers see in AI for radiology. But are all these studies looking at the same things, or are there diverse applications?
There's definitely a lot of focus on one area in particular: tumor detection. A large portion of the research is dedicated to tasks like identifying, classifying, and outlining tumors, especially in the lungs. Think of it like this. AI is really good at finding patterns. And tumors, even small ones, create disruptions in the normal patterns of our bodies. It's like finding a specific grain of sand on a beach.
Oh, that makes sense.
Yeah.
Early detection is key for so many cancers. But it sounds like there's a lot of research focused on a relatively narrow area. What about other applications of AI in radiology?
Well, there are other areas being explored, though they're not as well represented. Some studies are using AI to segment normal anatomy, which could be hugely helpful for planning surgeries or other procedures. There is also research into using AI for conditions like trauma, Alzheimer's disease, stroke, and even coronary artery disease.
So it sounds like we're still in the early stages with a lot of potential directions for AI and radiology to go. But how are these AI systems actually learning? It can't be as simple as just showing them a bunch of images, right?
You're right, it's more complex than that. The most common method is called supervised learning. Imagine you're teaching a child about different types of fruit. You show them an apple and say, this is an apple. Then you show them an orange and say, this is an orange. Supervised learning is similar. Researchers train AI algorithms on huge sets of images that are already labeled. For example, images of tumors that have been confirmed by a doctor. The AI learns to recognize patterns and features associated with those labels.
So the AI is essentially learning from experience just like a human would, but at a much faster pace and with a vast amount of data. But if most of these studies are focused on tumors, what kinds of imaging are they using? X-rays, MRIs, CT scans?
The majority of studies use cross-sectional imaging, with MRI and CT scans being the most common. This makes sense because these scans provide detailed 3D images which are ideal for AI algorithms to analyze. It's much easier for AI to detect subtle changes or anomalies in these complex images than in a standard 2D X-ray, for example.
So the type of imaging plays a big role in what the AI can learn and how effectively it can be used. It's not a one-size-fits-all situation. This all sounds incredibly promising, but I imagine there are challenges too, right? AI is still a relatively new field, and healthcare is complex.
Absolutely. While the potential is huge, there are definitely limitations to consider. One of the biggest is that most of these studies are retrospective. This means they use data that was collected in the past, rather than gathering new data specifically for the study.
So it's like trying to predict the future based on old newspapers. You might get some things right, but it's not a guarantee.
Exactly. And that raises questions about how well these findings translate to real-world clinical settings. Another limitation is that many studies use data from a single hospital or a single set of patients.
So the AI might be really good at analyzing images from a specific machine or a specific population, but not as accurate when faced with variations in equipment or patient demographics.
Precisely. And that highlights a key challenge in the field of AI and radiology, what researchers are calling the AI chasm.
The AI chasm. That sounds ominous. What does that refer to exactly?
It describes the gap between the promising results we see in research studies and the actual use of AI in clinical practice. Think about it. Research often happens in a very controlled environment. The data is carefully selected. The tasks are very specific. But the real world is much messier. Patient populations are diverse. Imaging equipment varies. And there are countless factors that can affect how well an AI system works.
So it's like taking a self-driving car that's aced its tests on a closed track and then putting it on a busy city street during rush hour. It's a whole different ballgame.
Exactly. And that's why rigorous testing and validation are absolutely essential. Before we can trust AI systems with patient care, we need to make sure they're robust, reliable, and safe in real-world settings.
It's a high bar, and rightfully so. We wouldn't want to deploy an AI system that's prone to errors or misinterpretations, especially when it comes to something as crucial as a medical diagnosis. So how do we bridge this AI chasm? What needs to happen to bring these promising technologies into the real world where they can actually benefit patients?
That's the million-dollar question. The study points to several key areas for improvement. First, we need more prospective studies. Instead of relying on past data, we need studies that specifically evaluate AI's performance in real-time clinical settings, with new data collected under controlled conditions.
So we need to shift from hindsight to foresight. Instead of looking back, we need to design studies that look forward and track how these AI systems perform in dynamic real-world environments.
Exactly. We also need to diversify the applications of AI in radiology. Right now, there's a heavy focus on tumor detection. But there are so many other areas where AI could be valuable. Think about predicting patient outcomes, personalizing treatment plans, or automating routine tasks to free up radiologists' time for more complex cases.
It's about expanding the scope and exploring the full potential of AI across various aspects of radiology. I'm sensing a theme here. A lot of it comes down to bridging the gap between the controlled world of research and the messy reality of clinical practice.
You're absolutely right. And that brings us to another crucial point: external validation.
External validation. I'm guessing that means testing AI systems in different environments than they were originally developed in.
Precisely. To know if an AI system is truly reliable, it needs to be tested on data from multiple hospitals, using different equipment and with diverse patient populations. This helps us identify any biases or limitations that might have emerged during the training process.
So it's like stress testing the AI to make sure it can handle the unexpected and perform consistently across a range of real-world scenarios.
It's like making sure a new medication works for a wide range of people, not just a select few. Now, let's say we have an AI system that has passed all these tests with flying colors. Can we just release it into a hospital and let it start making diagnoses on its own?
That's a great question. Even if an AI is incredibly accurate, there's another critical factor we need to consider: explainability.
Explainability is crucial in healthcare because doctors and patients need to understand how an AI arrived at its conclusion. They need to trust the AI's judgment to make informed decisions. Imagine an AI flags a potential issue on a scan. The doctor needs to understand why the AI flagged it, what features it considered, and how confident it is in its assessment.
So it's not enough for the AI to just point something out. We need to be able to understand its reasoning, its thought process. Is this level of explainability even possible with current AI systems?
That's one of the biggest challenges right now. Many AI systems, especially those based on deep learning, are incredibly complex. They can be accurate, but it's often hard to understand why they make the decisions they do.
So it's like having a brilliant detective who solves a case but can't explain how they did it. That's not very helpful and could even be dangerous in a medical context.
Exactly. We need to know if the AI is focusing on relevant medical factors or just picking up on random patterns in the data. This lack of explainability is a major hurdle for using AI in healthcare.
This raises an important question. If explainability is so vital for AI in healthcare, what's being done to address this challenge?
There's a whole field of research dedicated to developing explainable AI, or XAI. Researchers are trying to make AI systems more transparent and understandable. One approach is to design AI systems that can provide explanations along with their predictions. For instance, an AI that identifies a tumor could also highlight the specific areas in the image that led it to that conclusion.
So it's like giving the AI a voice to explain its thinking, allowing doctors to see the evidence behind its decisions. What other methods are being used to create more explainable AI?
Another approach is to use simpler AI models that are easier to interpret. While deep learning models can be incredibly powerful, they can also be incredibly complex. Simpler models, like decision trees, are often easier to understand because they clearly lay out the steps involved in making a decision.
So it's about finding a balance between complexity and transparency, choosing AI models that are both accurate and understandable. Are there other interesting developments in explainable AI?
One area that's gaining traction is the use of visual explanations. Instead of just text, researchers are working on ways to create visualizations that show how the AI is processing information and what features it's focusing on.
So it's like giving doctors a visual map of the AI's decision-making process, allowing them to see exactly what the AI is seeing and why it's drawing certain conclusions. That sounds incredibly helpful for building trust and understanding.
Absolutely. Now, shifting gears a bit, this study also highlighted an interesting issue: the lack of open access to data and code. Only a small percentage of the studies made their source code public. And while more shared their data, it's still not the majority.
That's a great point. Openness is essential for scientific progress, especially in a field as important as healthcare. Sharing data and code allows other researchers to verify findings and build on each other's work.
It's like trying to build a skyscraper without sharing blueprints. Collaboration and transparency are key to moving the field forward. This lack of openness can also hinder smaller research groups who might not have the resources to collect their own massive data sets.
So it's not just about scientific progress. It's about fairness and equal opportunity in AI research. Everyone should be able to contribute and benefit from these advancements.
Exactly. There are solutions, though. We could encourage the use of open data repositories where researchers can share their findings in a standardized, accessible way. We could also incentivize open science practices by rewarding researchers who share their work openly, perhaps through grants or recognition.
So it's about changing the culture of AI research to be more collaborative and transparent. This study also emphasized the need for higher-level evidence. The vast majority of studies were retrospective, looking at past data. But to really understand how AI systems will perform in clinical settings, we need more prospective studies, where data is collected specifically to evaluate AI's performance in real time.
It's like the difference between studying a baseball player's stats from last season versus watching them play live games this season. To truly evaluate their potential, you need to see them in action.
That's a great analogy. So we need to move from analyzing past performance to evaluating real-time impact. This shift to prospective studies will be critical in bridging that AI chasm we discussed earlier.
Absolutely. These prospective studies need to be rigorous and focused on clinically relevant outcomes. It's not enough to just show that an AI can identify something. We need to demonstrate that it can actually improve diagnoses, treatment decisions, and ultimately patient outcomes.
That's a crucial point. It's about proving that these AI systems can actually make a difference in people's lives.
And that brings us to the need for collaboration. Researchers, clinicians, industry partners, and regulatory agencies all need to work together to develop clear guidelines for safely and effectively implementing AI in radiology.
It's about creating a shared vision for the future of AI in healthcare, where patient well-being, scientific rigor, and responsible innovation are top priorities. We've discussed the challenges, but I don't want to lose sight of the incredible opportunities AI offers. What are some of the most exciting ways AI could transform medical imaging?
One of the most promising areas is improving diagnostic accuracy. AI can analyze medical images with incredible precision, often surpassing human capabilities in certain tasks. This could lead to earlier and more accurate diagnoses, potentially saving lives and improving patient outcomes.
It's like having a second set of highly trained eyes, helping radiologists to spot subtle details they might miss.
Exactly. And this is especially valuable in areas where there's a shortage of specialists or when radiologists are overwhelmed with a high volume of images. AI can help to lighten the load and ensure patients get timely and accurate diagnoses.
It's about using AI to augment human expertise, not replace it. A collaboration between AI and radiologists, working together to provide the best possible care. What other opportunities are there?
AI can also personalize treatment plans by analyzing a patient's medical history, imaging data, and genetic information. AI can help develop tailored treatment plans that are optimized for each individual. This could lead to more effective treatments with fewer side effects.
So it's about moving away from a one-size-fits-all approach to healthcare and towards a more individualized, patient-centered model.
Precisely. And this personalized approach goes beyond treatment decisions. AI can also predict patient outcomes, identify individuals at high risk for certain conditions, and even help develop preventive strategies.
So we're not just reacting to disease, we're using AI to proactively prevent it. That's a powerful shift.
And these are just a few of the exciting possibilities. As AI technology continues to advance, we can expect to see even more innovative applications in the years to come.
This has been an incredible deep dive into the world of AI in radiology. We've explored its rapid growth, the challenges of the AI chasm, the importance of explainability, and the incredible potential for transforming medical imaging.
It's been a fascinating discussion, highlighting both the potential and the complexities of integrating AI into healthcare.
As we wrap up, I'm left with a sense of both excitement and cautious optimism. AI has the potential to revolutionize healthcare, but we need to move forward thoughtfully and responsibly, carefully addressing the challenges along the way.
I completely agree. It's a powerful technology that requires responsible stewardship.
This deep dive has given us all a lot to consider. What's one key takeaway you hope our listeners will remember from our conversation?
I think the most important thing to remember is that AI is a tool. It can augment human expertise and improve healthcare. But it's not a replacement for human judgment, critical thinking, or empathy.
That's a crucial point. It's about finding the right balance between human intelligence and artificial intelligence, using AI to enhance our capabilities, not diminish them.
It's about finding the right synergy between human and artificial intelligence. And remember that technology should serve humanity, not the other way around.
We've covered so much ground in this deep dive, and I'm sure our listeners have lots to think about. What's one final thought-provoking question you would leave them with today? Something to spark their curiosity about the future of AI in radiology.
Here's a question that I find particularly intriguing. If AI could help radiologists analyze images more efficiently, could it also lead to shorter wait times for patients? Imagine a world where AI helps to prioritize cases, flagging urgent ones and streamlining the workflow for radiologists. Could this mean patients get crucial diagnoses and treatment faster, potentially improving outcomes and even saving lives?
That's a powerful thought. It highlights how AI could not only make diagnoses more accurate, but also make healthcare more efficient and accessible. It's a reminder that AI has the potential to make a real difference for patients, not just in the research lab.
Exactly. And it's crucial to remember that the future of AI in radiology isn't set in stone. We're all shaping it through the choices we make, the research we do, and how we choose to interact with these technologies.
It's a call to action for everyone involved, researchers, clinicians, policymakers, and patients, to engage in open discussions, ask critical questions, and work together to ensure AI is used ethically and for the benefit of all.
I wholeheartedly agree.
Well, this has been a fascinating deep dive into the world of AI in radiology. We hope our listeners have enjoyed exploring this complex and exciting topic with us.
We've covered a lot of ground today, and it's clear that AI has the potential to revolutionize the field of radiology. But as we move forward, we must prioritize patient well-being, scientific rigor, and responsible innovation.
If you're as intrigued by this topic as we are, we encourage you to share your thoughts and questions on social media using the hashtag #FiresideChatAI. We'd love to hear from you.
And be sure to join us next time for another deep dive into the cutting edge of science and technology.
Until then, keep exploring, keep questioning, and keep learning. Thanks for listening.